Welcome to the channel. I am a doctor, and today I'll talk about Cardiologist Explains. 5 blood pressure. Mistakes seniors make every single day. The management of hypertension in the geriatric population has entered a new and complex era in 2026, where the intersection of advanced pharmacology and the physiological realities of the aging body has created a unique set of challenges. For a senior over the age of 65, blood pressure is not merely a static number on a digital monitor. It is a dynamic reflection of arterial stiffness, renal efficiency, and autonomic nervous system tone. Despite the wealth of information available, many seniors find themselves trapped in a cycle of resistant hypertension, caused not by a failure of their medication, but by 5 specific mistakes made in their daily routines. To understand the gravity of these errors, one must first recognize that the aging vascular system is far less forgiving than that of a younger adult. A minor fluctuation in salt intake or a slight error in the timing of a dose can trigger a cascade of events leading to hypertensive urgency or, conversely, dangerous orthostatic hypotension. To reach the full investigative depth required to protect the senior population, we must deconstruct these daily errors from a molecular and mechanical perspective, moving beyond basic advice into the realm of precise vascular management. The first major mistake identified by top cardiologists in 2026 is the morning ritual error, specifically the consumption of black coffee or high-sodium healthy breakfasts immediately upon waking and before taking medication. As the body transitions from sleep to wakefulness, it naturally undergoes a surge in cortisol and adrenaline known as the awakening response. This surge is designed to raise the heart rate and blood pressure to prepare the body for activity. When a senior introduces caffeine, a potent vasoconstrictor, into this already heightened physiological state, it creates a pressure peak that can exceed the safety threshold of the cerebral arteries. Furthermore, if that senior then consumes a breakfast high in hidden sodium, such as processed whole grain bread or salted oatmeal, they are adding fluid volume to a system that is already under hydraulic stress. In 2026, the clinical recommendation has shifted to hydration-first protocols, where seniors are encouraged to consume 16 ounces of mineralized water and wait 30 minutes before any stimulants or heavy meals. This allows the body to stabilize its volume and pressure naturally, reducing the risk of a morning cardiovascular event. The second daily mistake involves postural ignorance and the failure to account for orthostatic changes. As we age, the baroreceptors in the neck, the sensors that monitor blood pressure and adjust it when we stand up, become less sensitive. Many seniors on blood pressure medication experience a sudden drop in pressure when they stand up, a condition known as orthostatic hypotension. The mistake lies in how they manage this. Often, when a senior feels a dizzy spell, they assume their blood pressure is high and may even take an extra dose of medication. In reality, their pressure is too low in that moment. This reactive dosing is a recipe for disaster, as it can lead to fainting, falls, and hip fractures. In 2026, cardiologists emphasize the 3-stage rise: sitting up in bed for 1 minute, sitting on the edge of the bed with feet dangling for 1 minute, and then standing slowly while holding onto a stable surface. This deliberate mechanical transition gives the aging vascular system the time it needs to shunt blood upward toward the brain, preventing the hypotensive crash that leads to thousands of hospitalizations every year. The third mistake is the supplement medication mismatch, particularly the use of NSAIDs like ibuprofen or naproxen for chronic aches and pains. Many seniors view these over-the-counter drugs as harmless staples of life, but in the context of hypertension, they are vascular saboteurs. NSAIDs work by inhibiting prostaglandins, which are chemicals that help the kidneys dilate blood vessels and excrete sodium. When a senior takes an NSAID, their kidneys begin to retain salt and water, and their systemic vascular resistance increases. This can effectively turn off the benefits of their blood pressure medication. In 2026, we have identified a phenomenon called NSAID-induced resistance, where a patient's pressure remains high, despite being on 3 or 4 different antihypertensives. The cardiologist's warning is clear. For a senior with high blood pressure, these common painkillers are not an option. We must shift toward vascular-safe pain management, such as topical treatments or specific physical therapies that do not interfere with the renal pressure system. The fourth error is nocturnal dehydration and the intentional avoidance of fluids in the evening. Many seniors stop drinking water at 6 p.m. to avoid waking up at night to use the bathroom. While this makes sense from a comfort perspective, it is devastating for blood pressure stability. During the night, the body loses fluid through respiration and skin evaporation. If a senior is already volume depleted when they go to sleep, their blood becomes more viscous. To move this thick blood, the heart must exert more pressure, leading to nocturnal hypertension. This is the primary reason many seniors wake up with a high blood pressure reading even before they have started their day. In 2026, the strategy has changed to microhydration, taking small sips of water throughout the evening and utilizing a pinch of sea salt to help the cells retain that moisture without stimulating the bladder. This keeps the blood laminar and the pressure low throughout the dark hours. The fifth and final mistake is cuff anxiety and the improper technique of home monitoring. Many seniors monitor their blood pressure multiple times a day, but they do so in a state of autonomic arousal. They might take their pressure immediately after an argument, after walking up the stairs, or while sitting with their legs crossed and their arm at the wrong height. When they see a high number, they panic, which releases more adrenaline, causing the next reading to be even higher. This feedback loop of fear leads to unnecessary medication increases and chronic stress. In 2026, the protocol for home monitoring is the 5-5-5 rule. Sit quietly for 5 minutes, take 3 readings at 5-minute intervals, and do this only 5 days a week. This provides a statistically significant average rather than a snapshot of stress. Furthermore, the arm must be supported at heart level. A hanging arm can artificially inflate the reading by as much as 10 to 12 points, leading to overdiagnosis and overmedication. To reach the full investigative depth of this analysis, we must look at the circadian pharmacological link. In 2026, we have discovered that when you take your medication is often just as important as what you take. Many seniors take all of their pills in the morning. However, for those with non-dipping hypertension, where the pressure stays high at night, this morning dose has often worn off by the time the high-risk early morning hours arrive. Cardiologists are now moving toward chronotherapy, where a portion of the blood pressure medication is taken before bed. This ensures that the vascular shield is at its strongest when the heart and brain are most vulnerable. This simple shift in timing can reduce the risk of stroke and heart attack by nearly 30% in the senior population, yet it remains one of the most common mistakes in daily management. The investigative journey also touches on the renal potassium paradox. Most seniors are told to avoid salt, but they are rarely told to increase potassium. In the aging kidney, the sodium-potassium pump requires an adequate supply of potassium to flush out excess salt. If a senior is potassium-starved, their body will cling to every molecule of sodium, regardless of how low salt their diet is. This is why many seniors see no improvement in their pressure despite eating bland, salt-free food. In 2026, the focus is on potassium loading through whole foods like avocados, cooked spinach, and white beans. By providing the kidneys with the fuel they need to excrete sodium, we can lower blood pressure naturally and reduce the burden on pharmacological interventions. Furthermore, we must address the white coat effect in reverse, known as masked hypertension. Some seniors have normal readings at the doctor's office because they are relaxed in a professional environment, but they have dangerously high readings at home due to the stresses of daily life, family, or poor sleep. This is why home monitoring, when done correctly, is the gold standard of 2026 geriatric care. It reveals the real-world pressure that the brain and heart are subjected to every day. A senior who only relies on the doctor's reading once every 3 months is making a critical error in their defensive strategy. They must become the investigative journalist of their own physiology, tracking the patterns that lead to spikes and dips. The psychological component of blood pressure management cannot be overlooked. In 2026, we recognize that hypertension is often a whole-body tension. A senior who lives in a state of chronic rushing or worrying is keeping their sympathetic nervous system in a state of high alert. This causes the arteries to remain in a clenched state, No amount of medication can fully override a brain that is constantly signaling danger. This is why vagal tone exercises, such as slow nasal breathing and gentle morning stretching, have become a formal part of the hypertension prescription. A relaxed brain is the most potent vasodilator in the world. The mistake many seniors make is thinking that blood pressure is a purely mechanical issue that can be solved with a pill, rather than a neurological issue that requires a lifestyle of calm. The investigative analysis concludes with a look at the vascular aging threshold. There is a common belief that blood pressure should go up with age. While some increase is normal due to the loss of elastin in the vessel walls, the 2026 standard has become more aggressive. We no longer accept 150/90 as normal for an 80-year-old. We know that every point above 120/80 contributes to the slow-motion destruction of the brain's white matter. The mistake is accepting mediocrity in blood pressure control. With the tools we have today, from chronotherapy and microhydration to potassium loading and proper monitoring, there is no reason for a senior to live with the silent killer. Reclaim your vascular health by avoiding these 5 daily errors. Your heart is an adaptable, intelligent organ that responds to the signals you send it. Send it signals of hydration, calm, and precision. In summary, the 2026 Cardiologist's warning is a call to action for every senior and their caregivers. Blood pressure management is a 24-hour-a-day investigative process. It requires moving beyond the one-pill-a-day mentality and embracing a comprehensive approach that accounts for sleep, hydration, pain management, and the timing of medication. By avoiding the morning ritual error, practicing postural awareness, eliminating NSAID interference, maintaining nocturnal hydration, and perfecting home monitoring, you are taking the most significant steps possible toward a stroke-free and heart attack-free future. The aging body is a masterpiece of resilience, but it requires a manual of care that is updated for the modern world. This is that manual. Honor your heart, listen to your arteries, and give your brain the vascular peace it deserves to thrive well into the 2nd century of life. Continuing this investigation, we must also address the hidden alcohol and hidden sugar traps that many seniors fall into. Even a single nightly glass of wine, which was once touted as heart healthy, is now recognized in 2026 as a major disruptor of nocturnal blood pressure. Alcohol causes an initial drop in pressure followed by a rebound spike 3 to 4 hours later, often occurring during the most dangerous part of the sleep cycle. Similarly, a high-sugar snack before bed triggers an insulin surge that tells the kidneys to retain more sodium. These innocent evening habits are often the missing link in why a senior's blood pressure remains high despite medication. The transition to vascular clean evenings, characterized by herbal teas and low glycemic snacks, is a critical component of the modern hypertensive protocol. Furthermore, we must deconstruct the sleep apnea hypertension connection. Many seniors ignore snoring or gasping at night, thinking it is just a sign of deep sleep. In reality, every time a person stops breathing during sleep, their oxygen levels drop and their blood pressure spikes to jolt the brain awake. This nightly battering of the arteries makes it almost impossible to control blood pressure during the day. In 2026, any senior with resistant hypertension is automatically screened for sleep apnea. Fixing the sleep habit through a CPAP machine or positional therapy is often the single most effective medication a senior can take. It addresses the root cause of the pressure rather than just masking the symptoms. The role of the microbiome in blood pressure control is also a burgeoning field of investigation. We now know that certain gut bacteria produce short-chain fatty acids that help to lower systemic inflammation and relax the blood vessels. A senior who eats a diet of highly processed soft foods is essentially starving these beneficial bacteria. This leads to leaky gut and systemic inflammation, which rusts the arteries and makes them less responsive to blood pressure signals. By introducing prebiotic fibers, like onions, garlic, and leeks, and fermented foods into the daily routine, a senior can reseed their gut for better heart health. This is the gut-heart axis that cardiologists are now prioritizing in their consultations. Finally, we must look at the magnesium-calcium balance. Many seniors take calcium supplements for bone health, but they fail to take magnesium. Calcium causes muscles, including the smooth muscle of the arteries, to contract, while magnesium causes them to relax. An overcalcified and magnesium-starved senior will have chronically clenched arteries. In 2026, the prescription is for a magnesium-first approach, ensuring that the body has the mineral relaxant it needs to balance the calcium. This mineral harmony is the foundation of a flexible, low-pressure vascular tree. Without it, the heart is fighting a losing battle against its own internal tension. The ultimate goal of 2026 geriatric cardiology is to empower the senior to be the CEO of their own heart. This requires a shift from passive compliance to active engagement. It means asking the why behind every spike and the how behind every habit. The brain is the most precious organ we possess, and it is the first to suffer when blood pressure is mismanaged. By avoiding the daily mistakes of the morning, the posture, the supplements, the hydration, and the monitoring, you are creating a fortress of health for your brain. You are ensuring that the golden years are lived with total cognitive clarity, physical mobility, and emotional stability. This is the promise of 2026 medicine, a life lived not in fear of the silent killer, but in the full confidence of a heart that is truly understood and meticulously cared for. The future of aging is not a slow decline, but a vibrant, high-precision journey. It starts with the very next choice you make for your heart. Adding another layer to the investigative analysis, we must examine the ambient environment and its effect on senior blood pressure. In 2026, researchers have found that noise pollution and blue light exposure late at night are subtle but significant drivers of hypertension. A senior who leaves the television on or lives in a noisy urban environment is subjecting their nervous system to constant micro-stressors. These stressors keep the heart rate slightly elevated and prevent the arteries from fully relaxing. The mistake here is believing that the environment doesn't matter as long as the pills are taken. In reality, creating a vascular sanctuary, a cool, dark, and silent bedroom, is a clinical intervention. It allows the body to drop into the parasympathetic state where the most profound blood pressure lowering occurs. We also look at the medication storage error. Many seniors keep their blood pressure medication in a kitchen cabinet near the stove or in a bathroom where humidity is high. In 2026, we understand that these vascular drugs are highly sensitive to heat and moisture. A pill that has been sitting in a humid bathroom for 3 months may have lost 20% of its potency. The senior is taking their medicine, but they are getting a diluted dose, leading to inexplicable pressure spikes. The advice is to keep all heart medications in a cool, dry, and dark drawer, ensuring that every dose is at its maximum pharmaceutical strength. The investigative journey also leads us to the dental hypertension link. Chronic gum disease is a major source of systemic inflammation, and in the senior population, it is a significant predictor of stroke and heart attack. The bacteria from the mouth can enter the bloodstream and attach to the arterial walls, causing them to stiffen. A senior who neglects their dental health is making a vascular mistake. In 2026, cardiologists often ask to see their patients' dental records, recognizing that a clean mouth is essential for a healthy heart. This is the interdisciplinary nature of modern medicine. Every system is connected. Lastly, we address the isolation pressure connection. Social isolation and loneliness are now recognized as being as dangerous for blood pressure as smoking 15 cigarettes a day. The mistake many seniors make is withdrawing from social life because of physical limitations or fatigue. This withdrawal triggers a stress response. The 2026 path to longevity is a return to a more holistic, high-precision way of living. It is the recognition that the silent killer can be defeated through a combination of cutting-edge science and timeless common sense. By avoiding the mistakes of the past and embracing the investigative insights of the present, you are building a future of resilience. Your heart is an adaptable, intelligent organ that has been beating for millions of seconds. Give it the gift of a precision lifestyle. Reclaim your vitality, protect your brain, and walk into the future with a heart that is strong, steady, and truly in balance. This is the standard of care in 2026. and it is available to every senior who is willing to look closer and live better.